You wake up every morning thinking you are safe. You check your phone. You drink your coffee. You feel fine. But between the moment your alarm sounds and the moment you take your first step, your heart is navigating the most dangerous window of your entire day, and almost no one knows it. According to the American Heart Association's 2025 Heart Disease and Stroke Statistics Report, cardiovascular disease remains the leading cause of death globally. Research published in Circulation confirms that adverse cardiac events, including acute myocardial infarction, arrhythmias, and sudden cardiac death cluster heavily in the early morning hours. This is not coincidence. This is a biological pattern driven by hormones, blood chemistry, and vascular mechanics converging at a single point in time. Here is what we are going to cover today. First, the exact mechanism happening inside your arteries before your eyes even open, and why it is measurably more dangerous after age 60. Second, the silent compound effect of 5 morning conditions that stack on top of each other in the space of under 3 minutes. Third, the one habit most people perform without thinking that turns a manageable surge into a potential cardiac trigger. And then the protocol. Simple, free, and grounded in peer-reviewed science. The kind of information that belongs in every cardiologist's first conversation with a patient over 60, and almost never is. Number 1, the hormonal surge that starts before you wake up. Your brain begins waking up roughly 60 minutes before you are fully conscious. The moment it does, it starts flooding your bloodstream with cortisol and adrenaline. These are not subtle shifts. Cortisol rises sharply in what researchers call the cortisol awakening response, and adrenaline follows. A study published in the European Journal of Endocrinology, tracking over 4,000 women aged 60 to 79, found that higher morning plasma cortisol levels were positively associated with blood pressure, cardiovascular risk markers, and subclinical atherosclerosis, including carotid plaques and coronary artery calcification. By the time you silence your alarm, your heart rate is already climbing. Your blood pressure is already rising. Your blood vessels are already beginning to constrict. This is normal human biology. The problem is what happens next. Number 2, arterial stiffness turns a manageable surge into a dangerous one. In a younger person, arteries are elastic. When blood pressure spikes in the morning, the vessel walls absorb the force, flex, and adapt. The system compensates in seconds. After 60, the picture changes fundamentally. A 2025 review published in Signal Transduction and Targeted Therapy described how aging produces structural changes in arterial walls, including calcification, fibrosis, and loss of elasticity. These changes are independent cardiovascular risk factors. The arteries cannot buffer the same morning pressure surge they once did. Every millimeter of mercury matters more. And in people with plaque already silently built up inside the vessel walls, which research from Mount Sinai published in late 2025 confirmed affects even patients previously told they are low risk, a sharp pressure spike can mechanically stress the fibrous cap sitting over that plaque. When that cap cracks, the clotting cascade begins. In a coronary artery, that is a heart attack. In a cerebral artery, that is a stroke. Number 3, morning dehydration thickens the blood before the first sip. After 7 or 8 hours without fluid, your blood is measurably more viscous than when you fell asleep. You lose moisture through breathing alone for hours. A 2025 study published in the Journal of the Neurological Sciences investigated wake-up strokes and found that blood viscosity was significantly elevated in affected patients on the morning of their event, with dehydration identified as a direct contributor to the hypercoagulable state. Thicker blood is harder to pump. It flows less freely through narrowed or inflamed vessels. It clots more easily. Clotting factors are at peak activity in the early morning hours, which is one core reason cardiac events cluster between 6 and 10 in the morning. The American Heart Journal research confirms this timing is not random. It is the biological consequence of a night of fasting from fluids combined with a hormonal surge arriving simultaneously. Number 4, Orthostatic hypotension, the pressure drop you are probably dismissing as normal. The moment you stand up, gravity pulls a significant volume of blood downward toward your legs and abdomen. In healthy younger people, the autonomic nervous system compensates instantly. Vessels constrict, heart rate adjusts, pressure is maintained. According to the NIH and research published in the American Academy of Family Physicians Journal, this reflex slows significantly with age. In adults over 60, orthostatic hypotension, defined as a drop in systolic pressure of 20 millimeters of mercury or more within 3 minutes of standing, affects between 10 and 30% of the population. That gray, dizzy, foggy feeling many people experience on first standing is not a quirk of aging. The Rotterdam study, a large population-based cohort, found that orthostatic hypotension increased the risk of coronary heart disease by 31% and all-cause mortality by 22%. Standing up fast forces an already hormonally stressed, viscous blood cardiovascular system to compensate for a sudden pressure drop. That compensatory spike is the trigger. Number 5. The magnesium drain that most people on blood pressure medication have never been warned about. If you take a diuretic, a water pill prescribed for blood pressure or fluid retention, there is an additional layer of risk that is seldom discussed. Diuretics work by flushing fluid through the kidneys. In that process, the kidneys also excrete magnesium. Magnesium is not optional for the heart. It regulates the electrical signals that control rhythm and prevents the kind of erratic firing that leads to arrhythmia. Research published in the American Journal of Medicine established a clear link between diuretic-induced magnesium depletion and ventricular ectopy and sudden unexpected death in hypertensive patients, particularly the elderly. A 2024 paper in the American Journal of Medical Sciences confirmed that dietary magnesium intake is directly associated with 10-year risk of a first hard cardiovascular event. And a December 2024 analysis found that roughly 45% of American adults fall short of the estimated average requirement for magnesium. If you are on a diuretic and have never had your magnesium checked, ask your doctor at your next visit. It is a standard blood test. It takes 2 minutes. It could matter more than most of what else is on your panel. Now here's the revelation that resolves everything we have covered. The 3-step morning protocol takes 90 seconds. It costs nothing. And every element is backed by the same evidence base we have just walked through together. The moment your alarm goes off, do not move. Take 3 slow, deliberate breaths. In through the nose, out fully through the mouth. A 2025 study published in Koreas found that abdominal deep breathing significantly reduced both systolic and diastolic blood pressure through parasympathetic nervous system activation, reducing sympathetic output and the stress hormone surge that starts your morning. 3 breaths, 15 seconds, then reach for the glass of water on your nightstand before your feet touch the floor. 1 full glass, room temperature. You now understand exactly why. Then roll to your side, sit on the edge of the bed, rotate your ankles slowly 5 times in each direction to activate the calf muscle pump and push pooled blood back toward the heart, and sit for a full 30 seconds before rising slowly. 3 breaths, 1 glass of water. Sit before you stand. The morning danger window is real, but it is not inevitable. Every week, I bring evidence-grounded information about what your heart needs after 60, the kind of information that should reach you before it matters most. If this was useful to you, share it with someone who needs it. Leave a comment telling me whether you drink water before anything else in the morning. Yes or no? I read everyone. And if you have not subscribed, now is the time. Your heart is working every minute of every day. Give it 90 good seconds each morning. That is more than a fair trade. You just learned why the morning is when your heart is most vulnerable. The next step is understanding what happens to it during the night before. Watch this video next.